how can then therapists help those patients that are afraid of moving? We know that they have a lot of fear involved. So, do you have any tips to help those patients?
Yeah. Well, once again, it's complex, isn't it? And,
Uh-huh.
you've had some great podcasts where, talking about the importance of therapeutic alliance. And if you don't have that therapeutic alliance, then it's really hard to create that context of safety to be exploring those threatening and, threatening movements, those things that they might be really hyper vigilant about. So I think one is, yeah, developing that relationship. And if you don't feel like you're connecting, you don't feel like they're trusting in you, then maybe that's a really nice cue for us to refer on or to bring in someone else with their permission, obviously an open discussion with that patient or that client, so that there is that relationship there to begin with. Second, I think, which kind of goes hand in hand with that therapeutic alliance, is that communication skills, to be able to listen, to be able to know when to maybe add a little bit of information, maybe ask for permission for bringing in that information, a bit of that education, to kind of go about it. So you might start with a bit more education before exploring movement in some of those cases. Or in some cases, you might really have that therapeutic alliance where they trust you, that they know that you're not going to do anything that's going to damage them. You are going to be doing things that might actually be sore, but you're making sure that they're safe. And I think if we can start to couch that idea, and create that context for them to go, all right, this person, I might be sore and I might be doing things that I'm a bit afraid of, but they are making sure that there's guardrails here, that my body is structurally safe while I'm exploring these, then I'm a little bit more comfortable to do that.
Mhm.
So I think there's hundreds of ways to create that safety and that trust and start to explore those really fearful movements. Peter O'Sullivan's group doing the cognitive functional therapy, they've got some really great strategies that kind of lean on exactly what we're talking about here, about creating that safety and really exposing people to those things that they're worried about, then reflecting on how the wheels did not fall off the bus just then. What else might be going on, and what was different about that situation? And then there's the education component, that other explicit sense making component as well, that I think all work together. And there's no perfect way to do it. I don't think any of my clinical interactions ever look even remotely the same. They look so different from session to session, and that's really based on how I feel I'm interacting with that individual, and where we're kind of at to how we might go about it. And it's very generally open ended conversations to kind of guide us in that direction.